All right, welcome to your personalized deep dive. This one's all about pheochromocytoma.
Oh, pheochromocytoma.
Yeah, and I know.
It's a mouthful.
It sounds intimidating, right? Like some kind of prehistoric creature,
It does.
But trust me, this tumor, it's way more intriguing than terrifying.
Absolutely.
We're going to unlock the secrets of this rare neuroendocrine tumor.
Yeah.
And you might be surprised to learn it's often misdiagnosed.
Yeah.
Because the symptoms can mimic so many other things.
It really is a master of disguise.
Right.
And the fact that it occurs in less than 0.2% of people with hypertension
Wow.
makes it even trickier to spot.
Yeah.
In fact, you might be surprised to learn that 10% of pheochromocytomas
What?
are discovered purely by chance.
10% just found accidentally.
Accidentally.
That's a bit unsettling.
It is.
No wonder you requested this deep dive.
For sure.
So what I'm gathering from these medical journal excerpts is that
Yeah.
we're dealing with a bit of a medical mystery here. This tumor that can cause some wild symptoms,
Yeah.
but often flies under the radar.
Exactly. One study we have here found that a whopping 58%
58%.
of patients with adrenal pheochromocytoma only stumbled upon it during scans for completely unrelated issues.
Oh, wow.
Imagine that, going in for a checkup for one thing and finding out you have this rare tumor.
Okay, so that explains the incidental discovery statistic.
Yeah.
Not like doctors are routinely screening for this.
No.
But if it's so rare,
Right.
what prompted doctors to even suspect a pheochromocytoma in your case?
Right.
Were there any telltale signs?
That's a great question, and it speaks to the challenge of diagnosis.
Yeah.
The symptoms can be so varied
Right.
and mimic other conditions from anxiety and panic attacks to severe headaches and heart palpitations. It's often a process of elimination,
Really?
ruling out other possibilities before arriving at a pheochromocytoma diagnosis.
So once the suspicion is there, how do they actually confirm it? I'm guessing it's not as simple as just looking at a scan.
You're right, imaging alone isn't enough.
Okay.
Doctors look for elevated levels of certain hormones like catecholamines
Catecholamines. Okay.
in your blood or urine.
Okay.
These hormones are produced in excess by the tumor
Right.
and can wreak havoc on your system.
Oh, wow.
And sometimes they even use special imaging techniques to pinpoint the tumor's location,
Okay.
especially if it's not in the adrenal glands, which is where they're most commonly found.
So we've got a sneaky tumor that's tough to diagnose.
Yeah.
Let's say they've confirmed it's a pheochromocytoma.
Right.
What's the next step?
Surgery is the primary treatment,
Okay.
and it's the only way to definitively remove the tumor.
Right.
But here's where things get really interesting.
Okay.
Preparing for surgery is just as crucial as the operation itself.
Okay, let's unpack that.
Sure.
What makes the pre-surgical phase so critical?
Well, imagine this tumor as a volatile volcano, constantly erupting with those excess hormones we talked about.
Uh-huh.
During surgery, any manipulation of the tumor
Right.
can trigger a massive surge of these hormones, leading to life-threatening spikes in blood pressure and heart rate.
So the pre-surgery prep is all about calming the volcano before they attempt to remove it.
Exactly.
Okay.
They need to get you stabilized
Right.
and create a safe environment for the surgeons to work.
Okay.
This involves a multi-pronged approach with medications and dietary changes.
You mentioned medications.
Yeah.
What kinds of drugs are we talking about?
The stars of the show are alpha blockers,
Okay.
specifically a medication called phenoxybenzamine.
Phenoxybenzamine.
Think of alpha blockers as the first line of defense,
Got it.
taming those hormone surges before they can cause too much trouble.
Uh-huh.
Phenoxybenzamine works by blocking the receptors
Right.
that those hormones usually bind to, essentially quieting their effects.
Okay, that makes sense.
Yeah.
So they use alpha blockers to get those hormones under control. What about beta blockers?
Yeah.
I've heard those are used for heart conditions. Do they
Right.
play a role here too?
They do, but there's a very specific strategy involved.
Okay.
Beta blockers are introduced only after adequate alpha blockade has been achieved,
Okay.
usually a couple of days before surgery.
Okay.
Starting with beta blockers first
Yeah.
could actually be dangerous.
That's unexpected.
Yeah.
Tell me more about why that order is so crucial.
It's all about maintaining a delicate balance in your circulatory system.
Okay.
Think of your blood vessels like a network of highways,
Okay.
and those hormones produced by the tumor are causing major traffic jams.
Right.
Alpha blockers work by widening those highways,
Uh-huh.
easing the congestion.
Got it.
Beta blockers, on the other hand, help control the flow of traffic.
Yeah.
In this case, your heart rate.
So I'm starting to see where this is going.
Yeah.
If you try to control the flow of traffic with beta blockers,
Right.
before widening the highways with alpha blockers. You could end up with even worse gridlock.
Precisely.
Right.
You could end up with a dangerous rise in blood pressure
Oh.
because the blood vessels haven't been properly relaxed yet.
Oh, okay.
So it's alpha blockers first to open things up,
Uh-huh.
and then beta blockers to fine-tune your heart rate.
Okay, that makes perfect sense.
Good.
It's like a carefully choreographed dance, getting everything in sync before the main event.
Exactly. They approach beta blocker dosage very cautiously,
Okay.
starting low and gradually increasing it to control a rapid heart rate,
Right.
also known as tachycardia.
Right. Tachycardia.
It's all about finding that sweet spot where your blood pressure and heart rate are well managed.
You mentioned dietary changes earlier. What's the deal with that?
Yeah.
I wouldn't think diet would play a huge role in preparing for surgery.
Yeah. You might be surprised.
Really?
One of the goals of pre-surgery prep
Yeah.
is to expand your blood volume.
Right.
Remember how we talked about those hormone surges,
Oh.
potentially causing huge spikes in blood pressure?
Yeah. Yeah.
Well, having more blood volume acts as a buffer against those surges,
Okay.
making your system more resilient.
So how do they increase blood volume?
Here's where it gets a bit counterintuitive.
Okay.
You'll be put on a high sodium diet.
High sodium.
We're talking over 5,000 milligrams daily.
Wow, that's a lot of salt.
I know it sounds crazy,
Yeah.
considering high sodium is usually associated with high blood pressure.
Right. Exactly.
But in this case, it's a calculated move to boost your blood volume
Oh,
and prepare your body for surgery.
So we've got alpha blockers, beta blockers, and a high sodium diet.
Right.
Are there any other approaches they might use in preparing for surgery?
There are a couple of alternative methods mentioned in the research.
Okay.
Sometimes they use calcium channel blockers, specifically nicardipine.
I know calcium channel blockers are used to treat high blood pressure.
Yes.
How do they fit into the picture here?
They work by relaxing the muscles in your blood vessel walls, which helps lower blood pressure
Right.
and reduce your heart's workload.
Gotcha.
They're a valuable tool, especially for patients who might not tolerate alpha blockers well.
So it's like having a backup plan
Yeah.
if the alpha blockers aren't a good fit.
Exactly.
What about the other alternative you mentioned?
The other option is a medication called metaricine,
Metaricine.
which takes a completely different approach.
Okay.
Instead of blocking the effects of the hormones,
Yeah.
it actually inhibits their production in the first place.
So it's like cutting off the supply at the source.
Exactly.
Wow.
It's a less common approach,
Yeah.
but it can be effective in certain situations.
So depending on your individual needs
Right.
and how your body responds to different medications,
Right.
they have a few different paths
Yes,
they can take to prepare you for surgery.
that's right.
Now, once they've prepped you, what's the preferred surgical approach for removing a pheochromocytoma?
That's a great question and leads us to our next exciting phase of this deep dive.
Okay.
Laparoscopic adrenalectomy has really become the gold standard,
Laparoscopic adrenalectomy.
especially for tumors under 8 centimeters that don't show signs of being cancerous.
I've heard of laparoscopic surgery. It's
Yeah.
a minimally invasive technique, right?
Yes, exactly. Instead of a large incision, the surgeon makes a few small cuts
Uh-huh.
and uses tiny instruments and a camera to remove the tumor.
Okay.
This means less pain,
Right.
faster recovery times,
Yeah.
and fewer complications compared to traditional open surgery.
That's definitely a plus
Well, sure.
within laparoscopic adrenalectomy.
Yeah.
Are there different approaches they might use?
There are a couple of main approaches they mentioned.
All right.
Transabdominal
Transabdominal, all right.
and retroperitoneal.
Those sound pretty technical.
They
Can you break those down for me?
Sure. Imagine your abdomen is a big compartment. With the transabdominal approach, the surgeon goes through your abdominal wall
Okay.
to access the adrenal gland.
Got it.
The retroperitoneal approach, on the other hand, goes through your back,
Through your back. Okay.
avoiding the abdominal cavity altogether.
Interesting.
Yeah.
So it's like taking a scenic route versus a direct route.
Kind of.
Are there advantages to one over the other?
There's some debate about which approach is better,
Okay.
but some studies suggest the retroperitoneal method
Yeah.
might be preferable in some cases
Okay.
because it avoids going through the abdominal cavity.
Gotcha.
But both approaches have been used successfully,
Okay.
and the best choice will depend on your specific anatomy
Right.
and the surgeon's experience.
Okay, so we've covered the general surgical approach.
Yes,
Is there anything different about the approach when dealing with familial pheochromocytoma?
that's an excellent question and brings us to another fascinating aspect of this tumor.
Okay.
Up to 24%
24%.
of pheochromocytomas are linked to hereditary syndromes like MEN2 and VHL.
Wait, so this tumor can run in families?
It can.
Wow.
And in these familial cases, they might consider doing a partial adrenalectomy
Partial. Okay.
to preserve some adrenal function.
I see.
They have to weigh the benefits of preserving function
Right.
with the risks of leaving behind any potential tumor tissue.
Right. That makes sense.
Yeah.
How do the approaches differ for MEN2 and VHL?
With MEN2, complete adrenalectomy is often recommended
Okay.
because the tumor tends to be more aggressive
Right.
and there's a higher risk of it spreading.
Okay.
But for some patients with VHL,
Yeah.
a cortical-sparing surgery might be an option,
Okay.
depending on the specific type of VHL.
Got it.
It all comes down to balancing the potential benefits
Yeah.
with the potential risks.
It's amazing how much nuance there is in treating this one type of tumor.
It is.
It seems like they really have to tailor the approach to each individual case.
Absolutely.
But even with all this careful preparation, I imagine things can still get a bit dicey during surgery.
You're absolutely right.
Right.
Even with meticulous preparation,
Yeah.
blood pressure can still fluctuate during the procedure.
Okay.
It's like a tightly wound spring
Yeah.
that can suddenly release
Right.
if something triggers it.
So what are some of the risk factors they've identified for these intraoperative crises?
High norepinephrine levels,
Okay.
which is one of those powerful hormones produced by the tumor, is a major risk factor.
Right.
Tumor size also matters.
Okay.
Larger tumors tend to be more volatile.
Got it.
And if you have significant drops in blood pressure when standing up after receiving alpha blockade,
Okay.
that's another red flag.
Oh, wow.
That things might be a bit unpredictable during surgery.
Okay. Those are good things to be aware of.
Yeah.
But what happens if a crisis actually occurs during a surgery? What can they do to manage the situation?
Thankfully, they have a few tricks up their sleeves
Okay.
to handle these situations. Sodium nitroprusside
Right.
is a rapid-acting vasodilator
Okay.
that can quickly lower blood pressure
Okay.
if it spikes.
If it spikes. Got it.
Phentolamine is a short-acting alpha blocker
Right.
that can provide rapid control of those hormone surges.
Okay.
And nicardipine, which we talked about earlier,
Right.
can also be used to manage blood pressure fluctuations.
So they're ready to respond quickly and effectively
There you are.
to keep you safe.
That's right.
That's reassuring to know.
Yeah.
They've got a plan A, B, and C,
Right.
but let's say the surgery is successful.
Okay.
What does the long-term outlook look like for someone who's had a pheochromocytoma?
That's where things get even more complex.
More complex, all right.
You see, about 10% of these tumors
10%.
are malignant,
Okay.
meaning they have the potential to spread to other parts of the body.
All right.
And here's the kicker.
Okay.
The only way to definitively know if it's malignant
Yeah.
is if they find local invasion or distant metastases during surgery or through follow-up testing.
So you could have this tumor removed
Yes.
and still not be completely in the clear.
That's right.
Wow.
And what's even more concerning
Yeah.
is that these metastases can show up years after the initial surgery.
Oh, wow.
It's a bit like a ticking time bomb.
Yeah, the ticking time bomb analogy really stuck with me.
Yeah.
So what does long-term monitoring look like? Are we talking regular scans and blood tests?
Exactly. You'll need to see your doctor for regular checkups,
Right.
including blood and urine tests to monitor those hormone levels.
Mm-hmm.
Imaging scans might also be necessary,
Okay.
especially if there's any sign of recurrence.
Okay.
And this monitoring might continue for years, even decades,
Wow.
depending on the specific characteristics of your tumor
Got it.
and your individual risk factors.
It's like a security system.
Yeah.
Making sure everything stays stable after the initial threat has been neutralized.
Right.
But let's say worst case scenario, the tumor does come back. What are the options then?
Well, if the tumor recurs,
Yeah.
surgery might be an option again,
Okay.
depending on the location and extent of the recurrence.
Oh, right.
There are also other treatments available,
Okay.
like radiation therapy or chemotherapy, which can help control tumor growth and manage symptoms.
So even if it's not a one-and-done situation,
Right.
there are still ways to manage it
Yeah,
if the tumor decides to make a comeback.
absolutely.
But what about those future treatments you mentioned earlier? Are there any exciting developments on the horizon that could change the game for people with pheochromocytoma?
There are some really promising areas of research
Okay.
that have the potential to revolutionize how we approach this tumor.
Oh, wow.
One area that's particularly exciting is targeted therapy,
Targeted therapy.
which uses drugs
Yeah.
that specifically target the tumor cells
Right.
while leaving healthy cells unharmed.
That sounds incredible.
Yeah.
So instead of using broad-spectrum treatments like chemo, which can have a lot of side effects,
They can pinpoint the attack directly on the tumor.
Precisely.
Wow.
These targeted therapies work by exploiting specific vulnerabilities in the tumor cells,
Okay.
either by blocking their growth signals
Uh-huh.
or by triggering their self-destruction.
So it's like a smart bomb
Yeah,
zeroing in on the target
right.
and minimizing collateral damage.
That's a great analogy.
Are any of these targeted therapies available yet, or is this still in the research phase?
Some targeted therapies are already being used for other types of cancer,
Okay.
and researchers are exploring their potential for pheochromocytoma.
Okay.
Clinical trials are underway to test the effectiveness and safety of these treatments,
Right.
and the early results are promising.
That's amazing.
Yeah,
It feels like we're on the cusp of a new era in cancer treatment.
I agree.
Yeah.
And it's not just about treatment.
Right.
Researchers are also working on ways to improve early detection of these tumors.
Okay.
Imagine if we could identify them before they even start causing symptoms.
Wow. That would be a game changer.
Absolutely. Early detection is key for so many health conditions.
Right.
What kind of advancements are they looking at in terms of early detection for pheochromocytoma?
They're developing more sensitive blood and urine tests
Okay.
that can pick up on those subtle hormonal changes even before they become noticeable.
Right.
They're also exploring new imaging techniques
Uh-huh.
that can provide more detailed images of the adrenal glands and surrounding areas.
It's incredible to think how far we've come in terms of medical technology
It is.
and how these advancements are giving us more and more tools to fight back against these challenging conditions.
For sure.
But beyond the high-tech solutions,
Yeah.
what about lifestyle changes?
Yeah.
Can those play a role in managing pheochromocytoma?
That's an important question, and it's one that often gets overlooked.
Yeah,
While lifestyle changes can't cure the tumor itself,
right.
they can certainly help manage symptoms
Okay.
and improve your overall well-being.
Okay, I'm all ears. What kind of lifestyle changes are we talking about?
Well, managing stress is crucial.
Stress. Okay.
Remember how we talked about those hormone surges?
Yeah.
Stress can actually trigger those surges.
Really?
So finding healthy ways to cope with stress is essential.
Oh, okay.
Things like yoga,
Right.
meditation, spending time in nature, or pursuing hobbies you enjoy can all make a big difference.
That makes sense.
Yeah,
It's about calming the mind
right.
to help calm the body.
Exactly.
Right.
Diet also plays a role.
Okay.
While you might need a high-sodium diet before surgery,
Right, right.
after surgery, it's important to focus on a balanced, nutritious diet
Okay.
that supports your overall health.
So no more all-you-can-eat salt fest.
Not quite,
Okay.
but a heart-healthy diet
Mm.
that's low in saturated and trans fats
Right?
and rich in fruits, vegetables, and whole grains
Yeah.
can go a long way in helping you feel your best.
Got it. Healthy eating, stress management,
Right.
and regular checkups. Those sound like manageable steps to take.
They are.
But I'm curious, from your perspective as an expert,
Yeah.
what's the most important piece of advice
Okay.
you would give to someone newly diagnosed with pheochromocytoma?
I would say don't be afraid to ask questions.
Yeah.
Knowledge is power,
Right.
especially when it comes to your health.
Absolutely.
Don't hesitate to ask your doctor anything that's on your mind,
Right.
no matter how small or insignificant it might seem.
That's great advice.
Yeah,
There's no such thing as a dumb question when it comes to your health.
for sure.
And speaking of questions, I have one for you.
Yep.
Given everything we've discussed today,
Yeah.
what stands out to you as the most important takeaway
Hmm.
for our listener?
I think the most important thing to remember is that even though pheochromocytoma is a rare and complex condition,
Yeah.
it's manageable
Okay.
with early diagnosis, careful treatment, and ongoing monitoring.
Yeah.
People with this tumor can live long and healthy lives.
That's incredibly reassuring.
It is.
Yeah, it's easy to get overwhelmed by the
Exactly.
medical jargon and the potential challenges.
Absolutely.
But at the end of the day, there's hope. And there are experts who can guide you through every step of the way.
That's right.
This deep dive has been such an eye-opening journey.
It has.
We've covered so much ground, from the initial shock of diagnosis to the intricacies of surgery
Yeah.
and the promising possibilities of future advancements.
Yeah. It's been a wild ride,
It has.
and I'm feeling so much more informed
Me too.
and empowered.
Absolutely.
It's amazing how much we've unpacked, right?
It is.
And we've done it all with the listener in mind,
Right.
tailoring this information to their specific needs and interests.
Exactly. This deep dive was designed to empower you,
Yes.
our listener,
For sure.
with knowledge and understanding.
Absolutely.
And that brings us to our final thought for you to ponder.
Okay. Yeah, it really has been a fascinating journey so far.
It has been.
And as you said, we've only just scratched the surface. There's a whole world of information still to uncover,
Oh, there is.
especially when it comes to the long-term outlook and potential future treatments for pheochromocytoma.
Exactly. We've talked about the challenges of diagnosis, the importance of pre-surgical prep, and different surgical approaches.
Right.
But what happens after surgery?
Yeah.
What does life look like for someone who's had a pheochromocytoma removed?
Well, the good news is that most people experience significant improvement in their symptoms after surgery.
That's good.
Those wild swings in blood pressure and heart rate tend to settle down,
Okay.
and many people feel like they have a new lease on life.
Oh, that's fantastic.
Yeah.
So it's back to normal life then.
Not so fast. Remember how we discussed the possibility of malignancy?
Right.
Even after a successful surgery,
Yeah.
there's still a chance that the tumor could come back,
Oh, okay.
especially in those cases where it's found to be malignant
Right.
or if there's a family history of these tumors.
Right. That ticking time bomb analogy
Yeah.
really stuck with me.
I understand.
So what does long-term monitoring look like?
Well-
Are we talking regular scans and blood tests?
Exactly. You'll need to see your doctor for regular checkups,
Uh-huh.
including blood and urine tests
Right.
to monitor those hormone levels.
Okay.
Imaging scans might also be necessary,
All right.
especially if there's any sign of recurrence.
I see.
And this monitoring might continue for years, even decades,
Wow. Decades.
depending on the specific characteristics of your tumor
Okay.
and your individual risk factors.
So it's kind of like a security system.
Yeah.
Making sure everything stays stable after the initial threat has been neutralized.
Exactly.
But let's say, worst case scenario,
Right.
the tumor does come back.
Yeah.
What are the options then?
Well, if the tumor recurs,
Yeah.
surgery might be an option again,
Okay.
depending on the location and extent of the recurrence.
Right.
There are also other treatments available,
Okay, like what?
like radiation therapy or chemotherapy,
Therapy, okay.
which can help control tumor growth and manage symptoms.
So even if it's not a one-and-done situation,
Right.
there are still ways to manage it
There are.
if the tumor decides to make a comeback.
Absolutely.
But what about those future treatments you mentioned earlier?
Yeah.
Are there any exciting developments on the horizon that could change the game for people with pheochromocytoma?
There are some really promising areas of research
Okay.
that have the potential to revolutionize how we approach this tumor.
Oh, wow.
One area that's particularly exciting is targeted therapy,
Targeted therapy? What is that?
which uses drugs
Okay.
that specifically target the tumor cells
Okay.
while leaving healthy cells unharmed.
So instead of using broad-spectrum treatments like chemo,
Right.
which can have a lot of side effects,
Yeah, a lot of side effects.
they can pinpoint the attack directly on the tumor.
Precisely.
Wow. How does that work?
These targeted therapies work by exploiting specific vulnerabilities in the tumor cells,
Okay.
either by blocking their growth signals
I see.
or by triggering their self-destruction.
So it's like a smart bomb
Yeah.
zeroing in on the target,
Right.
minimizing collateral damage.
That's a great analogy.
Are any of these targeted therapies available yet? Or is
Yeah.
this still in the research phase?
Some targeted therapies are already being used for other types of cancer,
Okay.
and researchers are exploring their potential for pheochromocytoma.
Okay.
Clinical trials are underway to test the effectiveness and safety of these treatments, and the early results are promising.
That's amazing. It feels like we're on the cusp of a new era in cancer treatment.
I agree.
Yeah.
And it's not just about treatment.
Right. What else?
Researchers are also working on ways to improve early detection of these tumors.
Okay.
Imagine if we could identify them
Yeah.
before they even start causing symptoms.
Wow.
That would be a game changer.
Absolutely. Early detection is key for so many health conditions.
It is.
What kind of advancements are they looking at
Yeah.
in terms of early detection for pheochromocytoma?
They're developing more sensitive blood and urine tests
Okay.
that can pick up on those subtle hormonal changes
Right.
even before they become noticeable.
Before they become noticeable. Okay.
They're also exploring new imaging techniques
Mhm.
that can provide more detailed images of the adrenal glands and surrounding areas.
It's incredible to think how far we've come in terms of medical technology
It is.
and how these advancements are giving us more and more tools to fight back against these challenging conditions.
For sure.
But beyond the high-tech solutions,
Yeah.
what about lifestyle changes? Can those play a role in managing pheochromocytoma?
That's an important question, and it's one that often gets overlooked.
Yeah.
While lifestyle changes can't cure the tumor itself,
Right.
they can certainly help manage symptoms
Okay.
and improve your overall well-being.
All right. What kind of lifestyle changes are we talking about?
Well, managing stress is crucial.
Stress.
Remember how we talked about those hormone surges?
Uh-huh.
Stress can actually trigger those surges.
Oh, really?
So finding healthy ways to cope with stress is essential.
Okay, like what?
Things like yoga,
Right. Yoga.
meditation, spending time in nature, or pursuing hobbies you enjoy
Yeah,
can all make a big difference.
that makes sense.
Yeah.
It's about calming the mind
Right.
to help calm the body.
Exactly. Diet also plays a role.
Okay.
While you might need a high-sodium diet before surgery,
Right, right.
after surgery, it's important to focus on a balanced, nutritious diet
Okay.
that supports your overall health.
So no more all-you-can-eat salt fest.
Not quite.
Okay, back to normal.
Yeah, pretty much.
But a heart-healthy diet that's low in saturated and trans fats.
Yes.
And rich in fruits, vegetables, and whole grains.
Exactly.
Those sound like manageable steps to take. But I'm curious, from your perspective as an expert,
Yeah.
what's the most important piece of advice you would give to someone newly diagnosed with pheochromocytoma?
I would say don't be afraid to ask questions.
Yeah, ask questions.
Knowledge is power,
Right.
especially when it comes to your health.
Absolutely.
Don't hesitate to ask your doctor anything that's on your mind,
Right.
no matter how small or insignificant it might seem.
That's great advice.
Yeah.
There's no such thing as a dumb question when it comes to your health.
For sure.
And speaking of questions, I have one for you.
Okay.
Given everything we've discussed today.
Yeah.
What stands out to you as the most important takeaway for our listener?
I think the most important thing to remember is that even though pheochromocytoma is a rare and complex condition,
Yeah.
it's manageable
It is manageable.
with early diagnosis, careful treatment, and ongoing monitoring.
Right.
People with this tumor can live long and healthy lives.
That's incredibly reassuring.
It is.
Yeah, it's easy to get overwhelmed by the medical jargon
Right.
and the potential challenges.
Absolutely.
But at the end of the day, there's hope.
Yes, there is.
And there are experts
Absolutely.
who can guide you through every step of the way.
That's right.
This deep dive has been such an eye-opening journey.
It has.
We've covered so much ground, from the initial shock of diagnosis to the intricacies of surgery and the promising possibilities of future advancements.
Yeah, it's been a wild ride.
It has been. I'm feeling so much more informed and empowered.
Me too.
Yeah.
It's been a pleasure diving deep into this topic with you.
Absolutely.
And remember, this deep dive was curated specifically for you
Right.
based on your interest in pheochromocytoma.
Right. Exactly.
It's a reminder that knowledge is power.
Absolutely.
And the more you understand about your health, the better equipped you are to make informed decisions.
Absolutely. This is just the beginning of your exploration.
Yeah.
There's a whole world of information out there
There is.
waiting to be discovered. Yeah.
Don't hesitate to delve deeper into the resources we've touched on today.
Please do.
And don't be afraid to ask questions.
Ask away.
And seek out additional information.
Absolutely.
Remember, you're not alone on this journey.
That's right.
There are experts, support groups, and online communities
Yes.
dedicated to helping people with pheochromocytoma navigate the challenges
That's right.
and embrace the possibilities.
Absolutely.
So keep learning, keep exploring, and keep diving deep.
Yes.
Thanks for joining us on this incredible journey into the fascinating world of pheochromocytoma.
It's been a pleasure sharing this journey with you.
Until next time, keep those questions coming, and we'll see you on the deep dive.
Given all the advancements we've discussed, what future innovation, do you think holds the most promise for revolutionizing how we diagnose and treat pheochromocytoma? Like, what's on the horizon that gets you really excited as an expert?
Yeah, it's a fantastic question.
Yeah.
For me, the most exciting possibility lies in the realm of personalized medicine.
Personalized medicine. Okay.
Imagine a future where we can analyze your individual genetic makeup
Okay.
and the specific characteristics of your tumor
Right.
to develop a treatment plan that's tailored precisely to your needs.
So no more one-size-fits-all approach.
Exactly.
It'd be like having a custom-designed treatment plan
Right.
based on your body's unique blueprint.
Precisely. We could potentially predict how your tumor will behave.
Wow.
How it might respond to different treatments,
Okay.
and even identify potential risks and complications before they arise.
So it takes a lot of the guesswork out. out of the treatment and gives patients a much clearer roadmap for their journey.
Yeah, absolutely.
That would be incredible.
And it goes beyond treatment.
Okay, beyond treatment. All right.
Personalized medicine could also revolutionize how we approach prevention.
Prevention, okay.
By understanding your genetic predispositions,
Right.
we could potentially identify those at higher risk of developing pheochromocytoma
Okay.
and implement strategies to mitigate those risks.
So we're shifting from reactive medicine
Yes.
to proactive medicine, preventing the problem before it even has a chance to take hold.
Precisely. It's a paradigm shift that could transform the landscape of healthcare
Wow.
as we know it.
That's big.
And it's not just a pipe dream.
Yeah.
The research is moving at an incredible pace.
It is.
And I believe we're on the verge of witnessing some truly remarkable breakthroughs
Yeah.
in personalized medicine.
That is really exciting.
It is.
This has been an absolutely incredible deep dive.
It has.
We've explored the depths of pheochromocytoma, from the initial diagnosis to the complexities of treatment and the promising possibilities of future advancements.
We have.
It's been a wild ride, and I'm feeling so much more informed and empowered.
And you.
And I hope you are too, listener.
Absolutely.
Remember, this deep dive was curated specifically for you based on your interest in pheochromocytoma.
It was.
It's a reminder that knowledge is power, and the more you understand about your health, the better equipped you are to make informed decisions.
Right. And don't hesitate to keep learning and exploring.
Exactly. Keep diving deep.
Yeah.
Thanks for joining us on this incredible journey into the fascinating world of pheochromocytoma.
It's been a pleasure.
Until next time, keep those questions coming, and we'll see you on the deep dive.